So over here I will be discussing all the alpha blockers. Now let's quickly classify the alpha blockers. They can be non-selective or they can be selective. Now selective alpha blockers can be selective at alpha 1 or they can be selective at alpha 2. Alpha 1 selective blockers can again be alpha 1 selective, means what I mean by that, it will block alpha 1A, alpha 1B and alpha 1D, all of them, or they can be alpha 1A selective. Okay, now let's list out the drugs first. That is, the non-selective alpha blockers are phentolamine, phenoxybenzamine and tolazolene. Alpha 1 selective blockers include prazosin, doxazosin, then terazosin, then alfuzosin, bunozosin, and the non-zosin drugs like urapidil, indoramine. The alpha 1A selective drugs are very important. These are tamsulosin and silodosin. The alpha 2 blockers are, there are primarily just two drugs, yohimbine and idazoxan. Now in your Viva exam, if you are asked about these alpha 2 blockers, first mention yohimbine, okay, and if the teacher probes any further, then only mention idazoxan, okay, because idazoxan as such doesn't have any clinical use, okay, no clinical use. And besides alpha 2 blockade, it also blocks imidazoline receptors. Okay, so if asked in your Viva, don't mention this at first. On the other hand, yohimbine has a number of non-FDA approved uses. Okay, none of these uses are FDA approved. So these are in a treatment of erectile dysfunction, diabetic neuropathy, postural hypotension, and it is also used as a nutritional supplement. It is derived from the roots of Rauwolfia serpentine, and from which we also obtain another drug, yes, that is reserpine. Sorry. Okay, so that's about yohimbine. Now let's come to the non-selective alpha blockers. Firstly, we'll deal with phentolamine. Phentolamine is a very important drug, and in your Vivas you will be asked about phentolamine. Sorry. Now, phentolamine blocks both alpha 1 and alpha 2, and it is a competitive blocker. Okay. Besides alpha 1 and alpha 2, it also blocks the serotonin receptors. Now, the different types of serotonin receptors, their function, I'll discuss it in the otocards portion. And it also has mild agonistic action at the muscarinic receptors, and also at the H1 and H2, that is histamine type 1 and 2 receptors. But of course, the most important action is alpha 1 and alpha 2 block. Okay. Now, it has a variety of uses. The most important of which it is used is the on-table management of pheochromocytoma. Now, over here we will discuss pheochromocytoma. Now, what is pheochromocytoma? It is a tumor of the adrenal medulla. And how is the diagnosis confirmed? Diagnosis is confirmed by urine 24-hour excretion of metanephrine and vanillyl mandelic acid, which are the metabolic breakdown products of the catecholamines. I discussed it earlier in my first video. So this 24-hour excretion of these two products will be markedly elevated, and this is how we clinch the diagnosis. For treatment, the treatment of choice, if asked, is surgery. Now here comes the pharma portion. The pre-surgical management is phenoxybenzamine. However, during surgery, if there is hypertension, the catecholamines will cause hypertension, and that is the most marked feature of pheochromocytoma. That is marked development of hypertension. So during surgery, if hypertension develops, we manage it by IV phentolamine. Okay, so that's why I wrote on table management of pheochromocytoma. Besides this, it is also used in the treatment of cheese reaction. Now, what is cheese reaction? This phenomenon was more commonly seen when MAO inhibitors were widely used in the treatment of Parkinson's disease. Now, what happens? Suppose this is the intestinal epithelial barrier. Then what happens is there are certain food like cheese or red wine. They contain a substance called tyramine. Tyramine passes into the intestinal epithelial barrier, where it is metabolized by MAO into inactive molecules. However, if the patient is on MAO inhibitors, then tyramine will pass through the intestinal epithelial barrier and will go to the central nervous system. Now, how does tyramine work? Suppose this is a presynaptic neuron, this is a postsynaptic neuron, adrenergic. Okay, this is a synaptic vesicle, and over here these are the catecholamines. Now, the tyramine has a very similar structure to these catecholamines, and hence tyramine is also called as a false neurotransmitter. Remember the fourth portion which I will be discussing is the false neurotransmitter. Just saying in brief over here, tyramine is a false neurotransmitter. So what tyramine will do, it will come into these synaptic vesicles, okay, and it will displace all these catecholamines which will come out and bind to the postsynaptic adrenergic receptors, and there will be marked hypertension. And for the treatment of that, we give IV phentolamine. So you can see in both cases, the two examples that I've discussed, we are giving IV phentolamine. So phentolamine is a drug not routinely used, but it is used in emergency cases. Okay. Other uses of phentolamine are clonidine withdrawal hypertension. Clonidine withdrawal hypertension. Now, what is clonidine withdrawal hypertension? Clonidine is a alpha 2 agonist, centrally acting. Now, if we stop taking the drug, suddenly hypertension will develop. Okay, and the mechanism of that I will discuss in my agonist portion. Other uses of clonidine are for the treatment of erectile dysfunction, and it is also used in the treatment of dermal necrosis. Caused by epinephrine extravasation due to epinephrine extravasation. Okay, so all the uses and the mechanism of action of phentolamine are very important. Okay, now phenoxybenzamine. Phenoxybenzamine as a drug has very limited uses, and one uses I have already mentioned, and that is your pre-surgical management of pheochromocytoma. The only appreciable point is that it is a irreversible inhibitor of alpha 1 and alpha 2, and hence its duration of action exceeds its T half, and such drugs are called hit and run drugs. Hit the target and run away, the action will stay. And another example of these are the proton pump inhibitors. Okay, remember. So that's another example of hit and run drugs. So not non-selective alpha blocker. Okay, other proton pump inhibitors. And the tolazolone, it is used for angiography to dilate the peripheral blood vessels. Okay, it does not have any clinical use as such. Now these three drugs, the alpha 1 selective drugs, prazosin, doxazosine, terazosin, these are used in the treatment of hypertension, and they are in fact the drug of choice in two cases: hypertension with dyslipidemia. Drug of choice I've written DOC for short, okay, and hypertension with benign prostatic hyperplasia. And why is that? This is because doxazosine and terazosin, in addition to alpha 1 blockade, will also promote apoptosis of smooth muscles of prostate. Alfuzosin was primarily used in the treatment of BPH, but no longer used. Bunozocin, urapidil, indoramine, all these drugs may be used in the treatment of hypertension, no longer preferred. Now, tamsulosin, silodosin, these two drugs, these are the drug of choice for treatment of BPH, benign prostatic hyperplasia. They will also promote apoptosis of smooth muscles of prostate, and they are free of the side effect of postural hypotension. Okay, so the alpha 1 selective drugs, they have the common side effect of postural hypotension, because they are blocking all the three types of alpha 1 receptors, that is alpha 1a, 1b and 1d. However, if we block the alpha 1a only, then the postural hypotension will not develop, because the vasoconstricting effect of alpha 1b will always be present. So they are free of, the alpha 1a selective are free of postural hypotension effects. However, they have these side effects, that is, one is called floppy iris, and the other is ejaculation abnormality. These two side effects are seen with the alpha 1a selective drugs. Okay, so let's just quickly revise. The alpha blockers are non-selective and selective. Non-selective include phentolamine, phenoxybenzamine, and tolazolone. Tolazolone has no clinical uses. It is only there are no therapeutic uses. It is used in angiography to dilate the peripheral blood vessels, particularly in a disease which is called Raynaud's disease. Okay, Raynaud's disease is that you will study in pathology. It is a disease of the peripheral vasculature. Phenoxybenzamine is an irreversible antagonist of the alpha 1 and alpha 2, and hence it is a hit and run drug. It is used in the pre-surgical management of pheochromocytoma. All the uses of phentolamine are very important. The alpha 1 selective drugs like prazosin, doxazocin, and terazosin, these are the drug of choice for the treatment of hypertension with dyslipidemia and or hypertension with benign prostatic hyperplasia. Alfuzosin no longer preferred for the treatment of BPH. Bunozocin, urapidil, and indoramine, you may use them for the treatment of hypertension. And tamsulosin, silodosin, they are the drug of choice for BPH. However, they have the side effect of floppy iris and ejaculation anomalies. And alpha 1 selective drugs will have the side effect of postural hypotension. Yohimbine, you will use, is an alpha 2 blocker. Non-FDA approved uses include erectile dysfunction, diabetic neuropathy, postural hypotension, and is used as a nutritional supplement, particularly in the United States. It is derived from the root of Rauwolfia serpentine. And idazoxan is an imidazoline receptor antagonist along with an alpha 2 receptor antagonist, and it has no clinical use as such. Okay, so please remember, phentolamine is the most important drug over here. You have to remember. So yeah, that's all for